Hi everyone, today we will be covering the medical specialties topic, and this is presented by Sora Kayla Mahi. Next slide, please. Okay, so today we'll be covering multiple topics, and then these are the 6 topics that we're going to cover in depth. And next slide. Okay, so first off, we have orthopedics. And then orthopedics, by its definition, is an area of medicine that deals with the correction of deformities of bones or muscles. And then by its definition, it may sound kind of rare and irrelevant to many of you, but it's actually more common than you think, because it's a muscular skeletal disorders affect more than 1 out of every 2 in the US aged 18 and over, and nearly 3 out of 4 people aged 65 and over. This is because we humans have 206 bones and 650 muscles, each and every having the potential to be injured. And then these injuries can vary from something as little as a sprained ankle to something more serious like a fracture or even a torn ligament. So obviously in those light cases, it can be treated clinically, but other times in those serious cases, in a surgical situation. For diagnosis, uh, for patients, usually start with the ordinary patient history and then a physical examination, and sometimes into further examinations using equipments like X-rays, CT scans, MRIs, and other equipment. Sports medicine is a subspecialty that I personally am interested as an athlete myself. It deals with general physical fitness, preventive care to prevent injuries, as well as treatment for injuries that already happened. Some of the major ones include ACL injuries, rotator cuff injuries, and arthritis. And going to specific treatments for ACL injuries, there are 2 different ways to treat it. The first way is a non-surgical external treatment, which we use brace and physical therapy to strengthen and stabilize the damaged ligament. So we don't actually like fix the injury, we just like stabilize it. And then this is usually common for older people who do not like plan to do any heavy exercises and only like light walking or something. However, for people that are planning to continue their sport or like heavy exercise, or who wants to like prevent the development of inflammation or arthritis, they choose a surgical method of complete reconstruction of the ACL. And then the surgeon either replace the damaged ligament with an autograft, which is the tissue taken from another part of your own body, or allograft from another tissue donor. And then the procedure requires use of a small camera since the knee is kind of small. And then after the operation, obviously they need a physical therapy. And then after a certain amount of time, they can return to their own activity. And then a famous example of this is a basketball player named Klay Thompson in Golden State Warriors, where he tore his ACL in 2019 and then ruptured his Achilles in 2020. But he was able to come back in 2022 and he currently still plays. So you can see how effective these treatments can be. Next slide. Okay, moving on, we have cardiologists. So I'm guessing many of you already know. They are the people who specialize in the field of hearts and blood vessels, because cardio means heart. But today I would like to talk about them a little more in depth. So cardiologists are able to diagnose patients' disease through tests with electrocardiograms, which in the top right, and then additionally through informations like weight, blood pressure, cholesterol level, and glucose level, they can further determine the conditions of our heart. Moreover, heart disease was the #1 leading cause of death in the US according to the National Safety Council in 2021, which emphasizes how much the cardiologists are important to minimize the loss of life. And then because the heart organ is so complicated, there are many subspecialties within the cardiologist to focus on certain parts of the heart. For example, the interventional cardiology focuses on the treatment of structural heart disease, while electrophysiology focuses on the electrical properties of biological cells and tissues. Some conditions that cardiologists are able to help or prevent are heart attack, stroke, which is a type of heart attack that affects the brain, and endocarditis. And for the treatment for heart attack, something called coronary angioplasty and stenting is taking place. And during the first part called angioplasty, the surgeon inserts a catheter. It's a thin tube-like thing in the picture, the left vessel in the picture, which can be dilated like a balloon. And then, as you know, heart attack is caused by the blockage of blood flow that like prevents the blood to go to the heart. But this process is able to open up the narrow vessel. And then a stenting, which uses a stent. It's like a meshed wire thing, also shown in the picture, the right one. This keeps the vessel widened to, and then the wire structure enables it for the blood to flow. And that was one way. And another way is a more urgent emergency type situation called bypass grafting, where you open up the heart and insert a vessel from another part of your body, and then it's used to flow the blood to the heart. And then after these surgeries, cardiac rehabilitation is required, where certain exercise, healthy diet, and stress management take place. And that's it for cardiology.
Next slide, please. So today's topic that I'll be covering is dermatology. Many of you already know dermatologists as the skin doctor, but there's something more to it. And dermatology focuses on diagnosing and treating conditions related to the skin, hair, and nails, and for patients of all ages. Dermatology is a career that I'm personally very interested in, and dermatologists do address a wide range of skin conditions such as acne, eczema, psoriasis, skin cancer, and allergic reactions, and also fungal infections, etc. These are just some common skin issues slash conditions that dermatologists deal with. Dermatologists use special tools to check our skin and sometimes take tiny pieces to look at under a microscope to provide better treatment. They also offer cosmetic dermatology procedures such as Botox injections, chemical peels, and laser treatments to address issues like wrinkles, scars, and pigmentation disorders. Now, there are three subspecialties in dermatology, which includes dermatopathology, pediatric dermatology, and cosmetic dermatology. It all allows them to focus on specific areas within the field. The first one we're going to talk about is dermatopathology. They specialize in diagnosing skin diseases by examining tissue samples under microscopes. It also helps dermatologists to accurately identify and treat various skin conditions. A dermatopathologist may analyze a skin biopsy sample to diagnose a patient with melanoma, providing some information for treatment planning and prognosis. Now, let's say, for example, if a patient has a suspicious mole on their face, the dermatopathologist analyzes a biopsy of the mole to check if it's cancerous or benign. And then they would help guide the treatment decisions and ensure proper care for patients' skin health. The second one we're going to look at is pediatric dermatology. Pediatric dermatologists focus on diagnosing and treating skin conditions specific to infants and children. They also ensure specialized care towards the unique needs of young patients. A pediatric dermatologist might treat a child with atopic dermatitis, which is also known as eczema, providing specialized care keeping the child's age and skin sensitivity in mind to alleviate symptoms and prevent flare ups. The third one is cosmetic dermatology. They Cosmetic dermatologists could perform a series of laser treatments to reduce the appearance of acne scars in a young adult, helping them improve skin texture and boost self confidence. Dermatologists often build long term relationships with their patients, providing continuity of care and the opportunity to witness positive changes in patients' lives over time. Next slide, please. Next, we'll be looking at pediatrics and the role they play in healthcare. Pediatricians are doctors who specialize in taking care of babies, children, and teenagers. They help kids stay healthy by giving them checkups, vaccinations, and treatments when they're sick. Pediatricians also help parents understand how to keep their kids safe, grow well, and develop properly. Some pediatricians become experts in specific areas like children's hearts or brain problems. Now, there are three pediatric subspecialties that we'll be looking at. The first one is pediatric cardiology. Pediatric cardiologists specialize in diagnosing and treating heart problems in children, ensuring that young patients receive specialized care for conditions like congenital heart defects or heart rhythm problems. An example for that would be a pediatric cardiologist diagnosing and treating a newborn baby with a congenital heart defect, such as ventricular septal defect, which is also called VSD, to ensure proper heart function and development. The second one is pediatric neurology. Pediatric neurologists focus on disorders of the nervous system in children, including epilepsy, development delays, and neurodegenerative diseases. They provide specialized treatments and support for young patients and their families. A pediatric neurologist helps kids with brain problems like seizures or trouble moving. For instance, they might work with a child who has trouble walking because of a condition called cerebral palsy, helping them get therapies and treatments to move better and feel more comfortable in daily life. The third one is pediatric oncology. Pediatric oncologists specialize in diagnosing and treating cancers in children, providing comprehensive care for conditions such as leukemia, brain tumor, and lymphoma. They work closely with multidisciplinary teams to offer treatments like chemotherapy, radiation therapy, and stem cell transplantation, ensuring the best possible outcomes for young patients facing cancer. An example for that would be a pediatric oncologist treating a child diagnosed with acute lymphoblastic leukemia, coordinating chemotherapy, bone marrow transplants, and other therapies to achieve remission and long term survival. In wrapping up our talk about pediatrics, it's clear that pediatricians are super important for keeping kids healthy as they grow up. They help prevent problems, catch them early, and give them best care possible from when they're babies until they're almost grown up. Thank you.
Okay, never mind. Another medical specialty that some of you might be interested in is ophthalmology. What is ophthalmology? Well, ophthalmology is a specialized field of medicine that handles the anatomy, physiology, diagnosis, disease, and the treatment of the eye. This field is important not only in medicine but also to people like us in our everyday lives. It is crucial for functioning, making ophthalmology important. Some common conditions treated in this field are cataract, macular degeneration, diabetic I don't know how to say that, glaucoma, cornea disease, and various eye infections. Of course, there are many more conditions, but usually they affect the vision and health of the eye. For example, blurred vision, glare sensitivity, and difficulty seeing at night are all characteristics of cataract when the lens inside the eyes cloud over. Glaucoma is basically damage to the optic nerve, which can lead to blurred vision or even blindness if left untreated. As you can see, eye conditions like these shouldn't be taken lightly since it is so important in our everyday lives. Now, within ophthalmology, there are several subspecialties that a doctor can specialize in, each focusing on specific aspects of eye care. Some common subspecialties include pediatric ophthalmology, neuro-ophthalmology, ophthalmic pathology, glaucoma, refractive surgery, oculoplastics, and etc. These subspecialties focus on a particular part of the eye. Each subspecialty requires specific training beyond general ophthalmology, meeting the needs of each condition. To diagnose eye conditions requires different tools and tests, which might include a refraction test, visual field testing, slit lamp examination, and tonometry. If any of you guys use glasses, you would know the refraction test, where they test different lenses using a trial frame. Another example is tonometry, which measures the pressure to screen for glaucoma. These are just a few examples of many diagnostic tools and tests used in optometry to evaluate eye health and vision. All in all, ophthalmology is important to preserving and improving vision using a variety of diagnostic and treatments and should definitely be something to look into. Next slide. Next, we'll be going over psychiatry and what that might look like. Psychiatry is a branch of medicine that deals with the diagnosis, treatments, and prevention of mental disorders. This branch is important in improving the well-being and life for an individual affected. Some common conditions found in psychiatry include autism, ADHD, bipolar disorder, major depression, schizophrenia, and OCD. These are just some of the most common conditions that a doctor can treat. Disorders like these may involve disruptions in someone's thinking, emotions, behavior, and their everyday lives. Psychiatry is a broad field that needs to meet the different needs of patients. There are a lot of subspecialties like adolescent psychiatry, which specializes in disorders in children and teens, addiction psychiatry, forensic psychiatry, neuropsychiatry, which focuses on the relationship between brain function and mental health, consultation licensed psychiatry. Each of these subspecialties require the specific knowledge and training to provide care for unique needs of patients. In psychiatry, diagnosis includes assessing the patient's symptoms, behaviors, and the patient's history. It is important to note the patient's subjective experience and behavior to accurately diagnose. Some of the many tools and methods used are neuroimaging, doing clinical interviews, psychological testing, assessments, and overall, the field of psychiatry involves understanding the patient and offering appropriate treatment. Next slide. Oh, thank you for listening to our presentation. I hope you learned more.
Okay, does anyone have any questions or any comments? Feel free to leave them in the chat as well. Obviously we didn't cover all the specialties today, but I'm interested to know what type of specialties everyone's interested in so that we can kind of gauge and how we can. Okay, when in your medical career do you pick your specialty? So so the specialty comes, so everybody has to go through medical school, and then in your 4th year of medical school, you apply to residency, which is where you choose your specialty. So throughout medical school, especially the 3rd year, you'll get like rotations where you have exposure to different medical specialties, and you kind of get to choose which one you like. So a lot of people that come in with like Sora and Mahi had like specialties that they're interested in. So you could have like a field that you're particularly interested in, but you don't ultimately decide until your 4th year when you're applying to residency, because that's when you go into more specialized fields. And some fields are specialties of other fields. So for something like oncology, you would go into internal medicine or pediatrics, and then after that, you would specialize in oncology. And then some specialties you go in directly, like dermatology, surgery, or like neurosurgery, or like cardiology or something like that. And so you don't have to have like a finalized um, decision when you apply to medical school. It comes like after you learn about the different fields and what it's like to work in those specialties, and you have a lot of time to decide. So like right now, a lot of us don't have exposure to like what it's like to work in these different fields. So we don't, you can't like expect us to like choose which one we like to like proceed with for the rest of our career, right? So you will have like adequate time to explore those specialties throughout medical school. And in college, if you choose to like shadow different doctors and stuff. Um, and so yeah, if that answers your question. But yeah, if anyone's, because I know we didn't cover every single specialty. There are specialties in like neuroscience, in surgery. And if anyone's like interested in those, you can feel free to talk about those as well. I think it's super inspirational. Sora, you like basketball and you like are inspired by sports medicine because of that, and you like sharing that and the examples of like Clay Thompson having an ACL tear. I think that's very inspirational. I also really like watching the Warriors. So yeah, when Clay Thompson was injured, that was really sad. But um,
I also think it was really helpful how Kayla and Sora and Mahi really connected the different specialties to like different diseases and common disorders. I think that's really helpful because a lot of us are looking into like peaceful careers. And I know those topics and specialties can seem really vast, but when we connect it to things that like some of us are more familiar with, like when you mentioned sports medicine, that sort of helps us like gain more insight into what each specialty really entails and helps us like sort of choose maybe what specialty we might want to focus in.
yeah, and then like I mentioned earlier, um, like the program here isn't just like weekly Zoom meetings. It's really about building like a community of people who are interested in going into health careers. So I know a lot of people are in high school. We especially have a lot of juniors in this cohort. So if you have any questions regarding like course selection or the college application process, feel free to reach out to myself. Happy to help in whatever way possible. And the medical field is really a collaborative field and depends on a lot the efforts of a collective group of people who are passionate about medicine. So I'm really happy to support anyone. Obviously, we really want you to succeed. So I'm happy to answer any questions or anything that you have. Um, Something that I wanted to share based on, sorry, we were talking about cardiology and EKGs. So has anyone ever seen like an electrocardiogram? I think I have an example. I can pull it up, but I take a little bit. Um,
Trisha, you said you saw an EKG, right? Do you want to give us like a brief, like, I don't know, rundown of what it looks like or what you saw?
Sure. So an EKG, it it's the electrical pattern of the heart, and it's like a wave. It's pretty cool.
Okay, can everybody see this? So this is what like an EKG, an ECG is supposed to look like. This would be like a normal one. Um, and so these are my notes, but um, basically you have a P wave right here, a QRS complex, a T wave, and then it repeats with another P wave. And this represents one cardiac cycle. And so a cardiologist would look at this, and depending on which of these waves is missing, they can tell where the problem is in your heart, like if there is a problem. And so kind of to take an EKG, you need 3 limbs. And so often you'll see like the like tape different I don't know what they're called, but they tape like different stickers to you kind of. And then it gives them insight on the activity of the heart. And so this is kind of what it looks like. The standard leads and the augmented leads that they can use to assess your heart. So this is what a normal healthy EKG is supposed to look like. And then here you can see that there are some waves that are missing. And so these can tell you about different problems with the heart. And depending on like which wave is missing, the cardiologist can often tell like which chamber of the heart or what problems have arisen. And so I thought that was super interesting. Does anybody know about like the structure of the heart? Okay, perfect. It seems like, yeah, there are 4 chambers and there's an atrium and ventricle. So this is just like a preview of like what you might see like in a college class or something. Um, so let me share this diagram here. So as people mentioned, there are 4 chambers. And so there are different circulations through these chambers to bring oxygen to your organs. So you have a systemic circulation, which goes from your left ventricle to your organs and then to your right atrium, and this is for oxygen consumption. And then you have a pulmonary circulation, which goes from your right ventricle to the lungs, to the left atrium, and this is for oxygen supply. So this is how you make sure that all your organs get oxygen, but you're also replenishing that oxygen. Um, and so in our class, we also learned about like arteries, which carry the blood away from your heart, and then your veins, which return blood to the heart. And so sometimes like when they're taking a blood test, they'll like look at which vein or artery they can poke the needle into to get more blood. And it is worth noting that the arteries have higher pressure because they're bringing blood away from the heart. So yeah, so cardiology is pretty interesting. If anyone's interested in other specialties as well, feel free to let us know. Yeah, I know we didn't cover all the specialties, but we're hoping that this gives you like a general idea of some specialties that you can look into. And honestly, there are limitless specialties that you can go into. Like some people do like a combination of 2, or they like specialize very deep into one. And so it really depends on your interest in different areas of medicine and what you're most interested in contributing to. And then I know in the coming weeks we'll talk a little bit about neurology, like the brain. The anatomy of the brain is also very interesting, and it works very closely with the heart and different organs in your body. Yeah, let us know if you have any questions or comments. And yeah, that's all we had for you today. So if you don't have any questions, have a good weekend. And then if you have one-on-one questions or any concerns, feel free to stick behind. Have a good weekend.